There are like around 100 clinical trials going on now. Only, I think, more or less than 20 are only primarily for urological cancers. The majority is more for advanced solid cancer. So the urological tumors are part of a bigger array of solid tumors. So there are just a few that are solely primarily for urological cancers. But one example, for example, you have this, it's a Coxsackie virus for solid tumors, for bladder cancer. You have some, Laherparepvec, that's a rheolysin for advanced castration-resistant prostate cancer. It's a clinical trial still in phase 2 now. So the majority is phase 1, phase 2. So it's still in the beginning of the clinical trials. And as mentioned, the T-VEC, this oncolytic virus, is already FDA approved, but not yet for urological cancers. But of course, the studies already done with these T-VEC. And the majority for prostate cancer is more of adenoviruses. And they have some engineered adenoviruses that are selective for PSA-producing cells. So that is prostate-specific antigen. So PSA, the tumor cells of prostate, they express PSA. And this virus can only replicate in those cells. And these are specific adenoviruses. And those are already used for a multitude of clinical trials, especially in prostate cancer, of course, because they are specific for prostate cancer. And there are many different studies, CG7870, all those kind of numbers are used for these virus clinical trials. And let me see, well, there's some other clinical trials going on with vaccinia virus. It's also a big virus, so you can modulate easily with some armed viruses. For example, PSMA-producing is in a study that's going on, PSMA-producing with metastatic tumors. There are many more, but the majority is not solely looking at urological cancer yet. But one other thing is what we're trying to do, we're working in the Netherlands with an oncolytic viral consortium. So that's a consortium of different hospitals in the Netherlands, and different urology is present, but also Immuno-Oncology. So it's a various consortium with various people working in this consortium on different cancers. And we are working on stratification of patients for different oncolytic viruses. So we have several aggressive tumors, including bladder and prostate cancer, but also pancreas cancer, glioblastoma, and then we have a few viruses we are looking at. And these viruses we hope to implement in clinical trials soon. But what we would like to do is compare these viruses head to head and to see which patients would react to which virus. So we have multiple tumors, multiple viruses, but which patient would react to which virus. So we do molecular profiling of the tumor and then get a piece of tumor of this patient, culture them ex vivo on an insert, and then add these viruses and to see which virus will kill which material from the patient. So maybe then you can better stratify patients and say, okay, well, this patient might benefit from a clinical trial with an adenovirus, but this patient you would better use for in a clinical trial with oncolytic virus, a real virus. So in this way, we would like to maybe better stratify patients for clinical trials. And later, of course, also for treatment, but that's in the future.